This is an overview of an article entitled Biomarker Glycoprotein Acetyls is associated with the risk of a wide spectrum of incident diseases and stratifies mortality risk in angiography patients. Published in the November 2018 issue of Circulation, Genomic, and Precision Medicine. High-throughput nuclear magnetic resonance, or NMR, metabolomics profiling of prospective cohorts has revealed that elevated blood concentrations of glycoprotein acetyls, or GlycA, are a strong predictive biomarker for long-term risk of morbidity and mortality from diverse diseases, many of which are associated with chronic inflammation. GlycA levels have been found to predict risk from cardiovascular diseases, certain cancers, type 2 diabetes mellitus, non-alcoholic fatty liver, chronic inflammatory conditions, severe infections, and all-cause mortality. GlycA itself is a heterogeneous NMR signal quantifying the combined levels of at least 5 circulating glycoproteins that are mainly produced in liver. The authors of the paper under discussion wish to evaluate GlycA as a biomarker for future risk of hospitalization or death across the spectrum of all common diseases. They first studied 2 independent population-based cohorts with complete 8-year electronic health record, or EHR, follow-up, utilizing high-throughput NMR data for more than 7,000 individuals in the FINRISK 1997 cohort and more than 4,500 individuals in the Dietary, Lifestyle, and Genetic Determinants of Obesity and Metabolic Syndrome cohort. They also investigated the potential utility of GlycA as a biomarker in secondary prevention in 900 angiography patients from the Angiography and Gene study during a 12-year follow-up period. Using EHR data from the 2 population-based cohorts, the authors observed strong and consistent associations between elevated GlycA concentrations and increased risk for 16 disease outcomes, including atherosclerosis, heart failure, acute myocardial infarction, angina pectoris, chronic ischemic heart disease, type 2 diabetes mellitus, respiratory infections, alcoholic liver disease, chronic renal failure, and chronic obstructive pulmonary disease. Hazard ratios were only weakly attenuated when adjusting for high-sensitivity C-reactive protein, or hsCRP, consistent with previous observations that GlycA is largely independent of hsCRP and may be reflective of a more diverse component of the inflammatory response. With the Angiography and Gene study, the authors found that GlycA was strongly associated with both 12-year all-cause mortality and cardiovascular mortality risk. As shown in the figures, when the angiography patients were partitioned by GlycA quintiles, there was a prominent increase in cardiovascular mortality risk with higher GlycA, with the highest quintile having 5 times the risk as the lowest quintile, translating into a 16% increase in absolute risk. In conclusion, increased GlycA was predictive of many incident diseases across many major internal organs, even after adjustment for hsCRP. GlycA also stratified mortality risk in angiography patients. Thus, GlycA might be useful in improving risk prediction in specific disease settings. Furthermore, this work might serve as a framework for future systems-level analyses of biomolecular data with linked EHRs in large-scale cohorts.